Trinidad and Tobago. You have just tuned into the most accurate and up-to-date source of information on the national COVID-19 response. That is the Ministry of Health's COVID-19 Media Conference. Today's panel of presenters are the Honorable Terence Dial Singh, Minister of Health, and Dr. Roshan Parsram, Chief Medical Officer. I am Odessa Curlane, Senior Corporate Communications Officer at the Ministry of Health, and I will be today's moderator. We begin with Dr. Parsram, who will present the latest clinical update.
Hi, good morning. Thank you very much, Ms. Curlane. Good morning to the Honorable Minister, members of the media, members of the viewing and listening public. So we begin as usual. If I could have the COVID dashboard for the 20th of September 2022, update number 1218. So looking at the new positive cases over the last 24 hours, 174. There have been no reported deaths over that period as well. Total active cases now standing at 4,259. Hospitalized patients, 159 for both step-down and hospital facilities. And in terms of our further breakdown, we have Couva Hospital Multi-Training Facility. We have 65 persons, 5 in the ICU, 9 in the high dependency unit. At the Cora Hospital, 27. Augustus Long Hospital, 27. Arima General Hospital, 18. Scarborough Regional Hospital, Fort King George, 6. And Scarborough General Hospital at Signal Hill, there are 2 persons at this time. If I could have the first presentation, so my second presentation would be an update on the COVID-19 and the multi-country monkeypox outbreak, international, regional, and local. So have the first slide, please. So as of September 20th, 2022, over 609 million confirmed cases globally and 6.5 million deaths have been reported worldwide. BA5, Omicron descendant lineages continue to be the dominant globally, including in Trinidad and Tobago. The week of September 5th to 11th saw the lowest number of weekly reported deaths since March of 2022. In March, as you recall, March 12, 2020, we actually reported our first case in Trinidad and Tobago. Next slide. So this slide will give a epi curve. If we go forward, please. In terms of the global situation, again, confirmed cases 609,848,852. And we're seeing, as to the far right end, that last bit of a curve, upward curve, is recognized as the Omicron phase of the epidemic so far. Next slide. If we could show the regional picture on the next slide, and this is data as of September 11th compared to the previous week, we're seeing a 27% decrease in the number of new cases and as well a 22% decrease in the number of deaths. And this is in the region of the Americas. Of course, Trinidad is part of the Caribbean region, which is a sub-region of the American region. Next slide. So this gives us a little bit of our epi curve from July 20th, 2020 to September 2022. And we're starting on the left-hand side. We could see our first variant of concern, which was the original lineage. And then we thereafter had Gamma on the 19th of the 2nd, 2021. And of course, Delta on the 30th of the 7th, 2021 being introduced to Trinidad and Tobago, causing our largest surge, which we see in November to more or less November of 2021 to January of 2022. If we look on the far right-hand side, in November of 2021, we would have seen the introduction globally of Omicron. And then, of course, in Trinidad and Tobago, we saw Omicron coming in and being confirmed on the 11th of December 2021. Thereafter, all of the curves on the right-hand side are related to Omicron, and I'll break those further into the sublineages in the next graph, so you can see how they would have caused a series of troughs and peaks as it progressed. Next slide. So beginning where I left off, so we're looking at January 2022 going forward. So you saw BA 1.1, which is a sublineage of Omicron, the original sublineage. BA2 shortly followed. And we'll see right after the graph, where the graph shows the introduction of a sublineage, you saw consistent peaks occurring and then followed by a trough. If you go over to the right-hand side, you see on the 11th of June 2022, BA4 was detected. And of course, where we are at now, Omicron BA5, detected on the 6th of July 2022. A small peak where you have the blue graph just before the brown on the 13th of the 8th, where we had a peak in terms of the total daily cases going up somewhere between 250 and 300 for a little period of time. And then, of course, we're now seeing a tapering off of BA5 in the population. Next slide. The next slide gives the overall percentage hospital occupancy within the parallel system. And I have two main points of concern were April 1st, 2022, April to May, where we would have had a significant spike in cases that would have been resultant from, I believe, Delta at that point in time, as well as Gamma. And then, of course, that large peak on the 1st of January there, where we had the highest occupancy in the parallel system on December 26th, where we only had one ICU space left. So that brings me to the end of the COVID part of it. We go to the monkeypox summary as well, if we go to the next slide. So for consecutive weeks, the region has been registering the highest number of confirmed cases, exceeding that of the European region. So if you recall, the European region was the epicenter of the present monkeypox virus outbreak. The Americas, the region of the Americas, is now the epicenter, and 2 cases were reported among indigenous people from the same community in Brazil, which of course is part of the Americas as well. There was an outbreak among inmates having been reported in the United States, in Texas, and in Brazil. Aside from those, you see a lot of it would have been imported cases. The USA accounting, if you go forward please, for the highest number of cumulative cases in the Americas region and globally. And as of September 14, 2022, the CDC reported 24,203 cases in the USA, 1 death in the USA as well, and thankfully we have seen very low case fatality rates from monkeypox to date. Global cases, according to the CDC, standing at 63,117. My last slide will just give you a little bit of the progression in the United States, which is now the epicenter, secondary epicenter, including the Americas. And we see from June on the left-hand side, 2022, where it all began early part of June, peaking in about August 21st, and going back down is usually consistent with a point source infection, and we are beginning to see a little bit of the tail end of that. So it's on the downslope in the Americas and hopefully in the world. So thank you, Ms. Curlane, for the brief time this morning.
Thank you, Dr. Pasram. We now go to the Honorable Minister.
Thank you very much, Odessa. Good morning to the Chief Medical Officer. Good morning to ladies and gentlemen of the media and members of the viewing and listening public wherever you are. It's good to be back with you all this morning. So, in recent times, since the start of August especially, we have been tracking our progress in dealing with COVID. On the 3rd of August, which is about 2 weeks after the mask mandate was lifted, our rolling 7-day average was 174. And then, as expected, by the 10th of August, it went up to 265. On the 17th of August, 280, where it peaked in this current period. As of today, our rolling 7-day average is 130. Concomitant with that was a rise and then subsequent decrease in our positivity rate. We peaked at 17th of August after the mask mandate was lifted, about a month after, at 39%. And this morning we are at 21.7%. Similar story with all the other indices that we use to determine success of our response and what to do with the hospital system. It is because of these favorable figures which we have at this point in time, a rolling 7-day average of 130, a positivity rate of 21.7%. Unfortunately, our rolling 7-day average for death still remains at 3 at this point in time, and mainly with the elderly unvaccinated. Our ICU levels continue to be very low. We have 10 persons in ICU this morning, which is very, very low. our hospital occupancy has been coming down. And if the CMO could just lend me that first slide that you have there. And what we also look at is the total number of active positive cases, which is at the lowest level it has been in recent times, 4,259. When we look at all these figures, and we feel fairly comfortable that there is no immediate threat to the healthcare system, we have decided that today's press conference in this format will be the last of the series of press conferences we've been having over the past 2.5 years. Of course, if there are any developments that we need to come to you with or that is concerning the public, we will hold a press conference at the Ministry of Health as needed, when needed. So today marks the end of our regularly scheduled press conferences at TTT. In saying that, I want to thank, first of all, every single member of the media who has been with us either intermittently or consecutively or faithfully over the past 2.5 years. If I am to single out, and I know I'll get into trouble for this, but there have been media practitioners who have been consistently with us, like Richard. Thank you very much. There have been many other members like Pryor who, were with us for the majority of the time. TV6 has always been here. In the early days, we had Radio Tambourine, all the other radio stations. I remember fondly, Stephen Cummins was one of our regulars in the first year or so. So, in making this decision, I want to thank the media for their cooperation, for carrying the facts, carrying the stories, members of the public who worked with us, those who took all the precautions. Thank you very much. And lastly, but surely most importantly, I want to thank every category of healthcare worker in Trinidad and Tobago who rose to the challenge and proved to Trinidad and Tobago what I knew always, even before being Minister of Health, that this public healthcare system that we take for granted is one of the best in the world. So thank you very much, Odessa, and we could take questions and answers now.
Thank you, Minister. Next up is the question and answer segment. We once again remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please ask your questions one right after the other to the relevant members of the panel. We will take 1 question per media house in all subsequent rounds of questioning. Today we begin with questions from Guardian Media Limited.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. Minister, I do have to say I'm feeling a little bit sad that we won't be having this press conference anymore. But anyways, back onto my questions. And firstly, last week, you and CMO had a meeting with the Attorney General, as Dr. Richards would have indicated. I just want to know if we could have any details on that, what that meeting would have been about. And secondly, I saw this morning that we had an update to the public health regulations. Now, I haven't gotten a chance to go through it, so I don't know if it's a case of it being extended the period or if there were any changes added in with it. Thank you.
Yeah, thanks, Richard. Yeah, so today is a day tinged with sadness, because I do feel that you and I, when I say you and I personally, plus all members of the media, we really formed a bond over the past 2.5 years, and I'm really grateful for it. And as I said, Richard, you are one who you were here from the very, very beginning. So yes, today is a bit sad, but it's a necessary thing, because at the Ministry of Health, we want to move on to dealing with a lot of other issues like our blood donation drive, our NCDs, mental health, and so on. So we need to reprioritize and refocus. So 1, let's deal with the public health regulations. They have simply been extended, I believe, to the 31st of December. No material changes have been made. The only real measure is the wearing of masks in healthcare facilities, both public and private. So it's a simple renewal. On the issue of the meeting with the Attorney General, I have been a member. There's a subcommittee of cabinet called the Legislative Review Committee, or LRC. I've been a member for 7 years, and I try to attend most of the meetings. So last week, Wednesday, coincidentally with the press conference, there was a meeting with the LRC, Legislative Review Committee, and the rules of cabinet confidentiality apply to all cabinet subcommittees. So it was a normal Legislative Review Committee. I have been a member for the past 7 years. It's just that coincidentally, it was called at the same time, basically for the press conference. Okay? Thank you very much.
Thank you, Honourable Minister. Next up, we have questions from TV6.
Good morning to the head table, Urvashi from TV6. Well, as we close off this series of conferences, Minister, on behalf of the media, I regret that not many more of my colleagues were present in this particular meeting. But just on behalf of the media, we want to thank the Ministry of Health for always being there and consistent and allowing us, whereas sometimes we may not have gotten answers, or the answers that we may have liked, at least that we were allowed and given the opportunity to pose our questions. So on behalf of the media, I'd like to thank you very much for that. Minister, it's interesting that, we close off these meetings at a point in time when we heard just last week, Dr. Tedros would have said the end of the pandemic is in sight. And, we're also reading that U.S. President Joe Biden, he also would have said the COVID-19 pandemic is over in the U.S. Is this a similar signal that we are giving to the Trinidad and Tobago population? And I'd like you to be clear to the population, is the pandemic over?
Okay, thanks, Urvashi. And again, you are one of the ones who have been here consistently, not every time, like Richard, but you have been here consistently posing your questions, and thank you for your kind words this morning. So, in the Trinidad and Tobago context, as you will realize, whenever questions are posed to me to comment on another country's response, I have always avoided that for good reason. A sovereign country can respond to COVID or any other thing as they see fit. And I have always avoided commenting on other countries' responses. The pandemic is not over, in my view, in the Trinidad and Tobago context. What Dr. Tedros said is maybe he's seeing the end in sight. However, to determine whether a pandemic is over or not, the WHO convenes an 18-member committee, as they have done in the past, to talk about smallpox, polio, and it is only when they convene that 18-member committee and come to some form of consensus would we hear something from WHO as to where we are with the pandemic. A pandemic does not really have a defined end date, because what is going to happen with COVID-19, it is most likely, note my words, most likely, like influenza, like swine flu, which I had, it is going to become endemic. So it may not necessarily be over where you have no COVID anywhere in the world or in Trinidad and Tobago. It is going to become part of our public health landscape. And the same way we have to manage influenza by being vaccinated, by practicing cough etiquette, this is how we are going to have to deal with COVID in the future. Okay? So I hope that answers your question, Urvashi. And again, thank you for your kind words, and thank you for your very frequent presence at these press conferences.
Thank you, Minister. Next up, we have questions from TTT.
Good morning, Sonalala, TTT News. Minister Dayal Singh, based on, what my colleague would have just said, the WHO chief would have said, the end of the pandemic is in sight. Just like when they declared the pandemic, basically COVID a pandemic, they put certain things in place. if the pandemic were to end tomorrow, let's say, what would this mean for Trinidad and Tobago? Would we have any regulations or anything like that that would come off? And just secondly, for me, in terms of influenza, how have we seen that going in the last 7 days or so? I know there was basically a little spike that they reported, the officials reported on the last one. Any update on that?
Thank you, Sunil. So before I answer your question, Sunil, I think a lot of thanks has to go out to TTT this morning. To TTT, to your line minister, Minister Simon de Nobrega, to the management and staff of TTT, who have accommodated us, given us this studio, given us your real estate, given us your space. A very grateful thank you. It was a team effort. And again, a little bit of sadness as today is our last day. Yeah, so to answer your question directly, so Sunil, the only regulation that is in place now is the wearing of masks in the healthcare setting, whether it's private or public. So there's very little to do if theoretically, as you say, the pandemic is declared over tomorrow. Trinidad and Tobago is open, has been open. Many countries of the world recently opened up travel. So we have to get past this now. And as we say, as we learn to live with COVID, as we move from a epidemic to a pandemic to be an endemic, the typical public health measures that we ask people, cough into your sneeze into your crook of your arm, avoid touching surfaces, sanitize, all those things are going to be equally important. I will ask the CMO to talk about influenza if he has any information on it.
Yeah, so I think Dr. Hines would have given an update last week. More or less the same sort of trends we're seeing. So now that COVID-19 is really accounting for 21% of the viral illnesses presenting to the health facility, what it means, of course, is that 79% of those people that present are not COVID-19, are something else. So what we have started doing for many months now is once you get a COVID negative, especially with cases of severe acute respiratory illnesses, those are being subtyped to see what they are. What we're finding is, of course, influenza, which is, we started to pick it up in May and June and July, which is a little bit early in terms of the flu season, the traditional flu season, and we're picking up some RSV, which is respiratory syncytial virus. That is what is coming back from the lab so far, which is part and parcel of the common cold. So we're seeing common cold, we're seeing influenza, and of course we're seeing COVID as well. So those are the things that we tend to see persisting. We will increase our testing through the Trinidad Public Health Lab and the Caribbean Public Health Agency to see if we could subtype further to make sure there is nothing new in circulation. And then, of course, the public health measures will be tailored to suit.
Thank you, CMO. We now have questions from TV6.
Guardian Media.
Guardian Media.
Okay.
My apologies.
You give my job change there, man. Minister, can we have an update on the monkeypox tests that we would have submitted? I believe the last number that we had from the week before would have been 13, if I'm not mistaken.
Yeah, so I got the figure this morning. Currently it's 14. So there has not been any increase massive. It just increased by 1. And 14 samples were sent for testing, and all are negative to date. Okay?
Thank you, Rashad. We now move on to TV6. Uvishai.
Thanks again. Minister, or maybe CMO, can we get an idea of the vaccine stock, one, and what do you anticipate will happen now in terms of uptake? Are you still encouraging people to uptake? Will you centralize uptake maybe at this point? Can you just give us some feedback on vaccinations? Thank you.
Yeah. So, Urvashi, I will take that question. So, vaccine uptake has been consistently low in recent weeks and months. So like for yesterday, there was a total of 75 doses done across 109 health centers, which is less than 1 per health center. So that's where we are with vaccine uptake. To date, 716,898 have completed their vaccination schedule. That's 51.2% of the population. So as you know, we have been stuck at 51% for the longest while. Vaccine stock. I have it here. Sinopharm, 246,785, expiring June 2023. Pfizer adult, we have none. Johnson & Johnson, 185,925, expiring between May and July 2023. And the Pfizer pediatric for 5 to 11 years, 38,670, expiring October 2022. Urvashi, thanks for raising the question. We'd just like to remind parents again that your cutoff date for having your children 5 to 11 vaccinated with the Pfizer pediatric vaccine is September 30th. That will give you 4 weeks, which is the minimum window required to get your second dose. So that's where we are with vaccine stocks and their expiry dates.
Thank you, Minister. I'm seeing Rashad's hand still up. Guardian Media Limited, you have additional questions?
Yeah, so as we're on the topic of vaccines, Minister, do we have a count and possibly a breakdown of the amount of vaccines that unfortunately would have had to be discarded off because they would have reached expiration dates? And if within that, you could give us an update on the monkeypox vaccine that we've been trying to get through PAHO.
Yeah, sure. So the number of Sinopharm vaccines which we received in total would have been 1,189,000. So I just gave what we have balanced, 246,785. So basically we would have administered 918,389. Pfizer, we would have received a total, this is Pfizer Delta, all the different donations, and we want to thank the U.S. government and their people. 684,970. We would have administered 358,885. So just about half. So the rest would have been destroyed. Johnson & Johnson, we would have gotten in a total of 259,200. We would have administered 60,370, and I just gave you how much more we have remaining. AstraZeneca, 277,220 were received, whether it's through the COVAX facility or through donations. We would have administered 241,167. And the Pfizer pediatric, I want to thank the Kingdom of Spain, the people of Spain, and also His Excellency, the Ambassador to Trinidad and Tobago from Spain. 43,200 we received, and we administered 3,710. So that's a complete breakdown of what we received, what we administered, and what we have balance on hand, and what was destroyed. Okay? Thanks.
If there are no further questions, and as we draw the curtains on these press conferences, we ask that you, Trinidad and Tobago, please continue to protect yourself and your loved ones. We want to remind the public that COVID-19 vaccines are available for everyone 5 years of age and above. If you have not received your COVID-19 vaccine yet, please get yours now. Remember, the vaccines are safe, effective, free, and available at multiple locations. We invite you to visit our website at health.gov.tt and our social media pages for accurate and up-to-date health information. Finally, as we continue to roll back restrictions, let's continue to observe the 3 W's. Goodbye.
Hurricanes and tropical storms are becoming more frequent for us in the Caribbean. The floods they bring are the #1 cause of weather-related deaths. For those who have disabilities, safety is of particular concern. You can significantly increase your chances of surviving floods by practicing these proven safety tips. Make an assessment and create a plan. Consider questions such as what personal care and assistance is needed, electricity requirements for equipment such as lifts, and what happens if water is cut off for a number of days during a flood. Also, consider food, medications, and emergency services needed in case of a storm. Arrange a meeting with family and caregivers to review information assembled, contact information, and needs in case of a flood. Know the hazards around your home and your community and how to deal with each. Assemble a disaster survival kit. Put together a kit for being able to evacuate in case of floods. This should include all medications, extra clothing, toiletries, and other day-to-day needs, a cell phone, or if possible one with an extra battery, a flashlight, non-perishable food items, and bottled water. These items can be kept in a waterproof container and should be regularly inspected with expiration dates checked and replenished with fresh supplies as they are needed. Listen to the radio or watch TV stations for the latest information and updates about expected storms. Be prepared to evacuate quickly and know your routes and destinations. Find a local emergency shelter. Check your emergency kit and replenish any items missing or in short supply, especially medications or other medical supplies. Keep it nearby. Stay indoors. Don't walk on beaches, riverbanks, or in flood waters. Use flashlights in the dark if the power goes out. Do not use candles. Continue listening to the radio or watch TV stations for the latest information and updates. Avoid contact with flood water. Just 6 inches of fast-flowing water can knock you over and 2 feet will float a car. It may also be contaminated with sewage or contain dangerous insects or animals. If you need to evacuate and get caught on a flooded road with rapidly rising waters, get out of the vehicle quickly and move to higher ground. Let friends and family know you're safe. If evacuated, return only when authorities say it is safe to do so. Continue listening to the radio or watch TV stations for updated information and instructions. Stay alert for extended rainfall and subsequent flooding. Seek help from family, friends, or caregivers to inspect your home for safety as well as cleanup. If you have a unique situation, or if you are a caregiver, a friend or family member, or person who requires additional support, take the time to help them prepare. We all owe it to ourselves to take these steps to heart so we all can prepare if flooding occurs.
This is TTT. Live for local.
We are students of BATC's 6th form, and the COVID-19 pandemic has been really tough and stressful for us.
It messed with me mentally.
I know the whole online thing affect my grades personally.
Yeah. I feel as if online school is so easy and you just have to log on your laptop. I was so frustrated. I found myself crying and coughing the wall. Transition from physical to online school is a huge adjustment here, and I feel like many adults don't understand. They feel as if online school is so easy and you just have to log on your laptop, but I actually found myself experiencing increased levels of stress. I was overwhelmed. There was this huge pressure on me, especially to create boundaries. I don't know if you all experience this as well, but I felt as if I didn't have a boundary between my home life and my school
For
life.
sure.
Yeah, I know the whole online thing affect my grades personally.
Yeah.
Right? Because it's just, I don't feel to turn in those assignments.
Yeah, I was so frustrated. I found myself crying and coughing the wall. Like, I didn't understand what was happening. Like, it was so weird because I didn't understand why it was happening or what caused it, but it just happened. And yeah, I just went to my mother crying.
At one point, I was actually considering dropping out.
Same.
Because I had a really bad mental breakdown. And I couldn't take it anymore. And then my home life wasn't making it any better. And then teachers wasn't making it any better.
You know, and although I do sympathize with the teachers and what they are going through during this time, I feel like much of the thought isn't given to us.
Yeah.
And the struggles and the pressures that we are going through as well.
I don't think they understand that even though we're home, we're not sitting down in front of the computer 24/7 because of COVID, right? And the financial impact on our family. We had to open up a small frozen food store. So I sell sometimes during the day. So my teacher will be on my table and she talking. And I selling something there, the glass there, and I packaging meat, so I handling fish. Hey, look, give me a change, right? And I don't understand what's going on. So when I sit back down, I was like, wait, we in groups? What happening?
I have so much responsibility placed on me as a woman, where like being able to cook or being able to take care of my siblings is actually given more priority than my education.
Yeah.
So most of the time, well not most of the time, but for some classes, I could find myself like my class on a tablet and I am cooking breakfast and lunch, you know, like during the class, and then if the teacher call me, I might be so I be so embarrassed to answer that I wouldn't even unmute my mic and say anything.
Yeah. I also feel like teachers don't put into consideration children that don't have their own personal space at home.
Oh my God.
So sometimes they'll be pressuring us, phone your camera, yeah, you could put background, but next thing my brother walk behind me, pay back.
And you know, I think sometimes to like your family, that's kind of irritates you.
Oh gosh.
Especially when you're in class.
Yeah. You're in class. How about she wears some quickness?
Yeah.
Oh my God, there was a class, my mother cleaning a strainer in the sink, and she just hits in the sink. And I'm like, but why are you doing this?
You just decide to make mango punch the same day you are class. Like.
All of a sudden you in the blender. And
I feel like, but I have to cook.
Yeah.
And then it had the neighbors, oh gosh.
And I'm buying the scrap iron.
Oh gosh.
I had told my mother, right, if she could please not shout at my brothers so much, because they just give real plenty trouble in the online school. So I tell her if she could please not shout so much at them. And that was obviously a real big mistake. she snapped. She just started yelling more, and she just stormed off into her room and slammed the door, right? She make me feel real bad, but like, I'm trying to listen to the teacher, and even with when the place quiet, my mind drifting. I can't focus on the screen.
I don't know what it's like to teach in the online environment, but I know what it's like to be a student. And I think that the people, the higher powers, or the powers that be, need to operate with empathy, because we're all going through a hard time. It's a pandemic. There's so much negativity and sadness around us, but we need to really operate as one. We need to find a way to come together and empower and help each other.
I think everybody had to find a person and be there for them, listen to what they have to say. Because like all these new issues coming up, all these, it's not just like saying, oh, so and so, this one like this girl and the girl don't like me back or whatever. It's not them issues we having anymore. We having issues like I waking up in the morning and I can't focus. I can't sit. Sometimes I can't sleep.
Yeah.
Because I know I probably shouldn't be sleeping because I need to catch up on my
Not only that, sometimes you can't sleep because of your home situation.
Communication is so important. I think that parents need to speak to each other and have that community. Like we have our community among ourselves.
Yeah, I feel like they need counseling themselves because it is new to them as well.
Because some of the problems that we are going through, if we're being honest, they can't fix. But just to know, as a young person, that you're being heard, that is really important. Because when that doesn't happen, then you're just there with your thoughts, and that's when the mental health crisis starts. Even the CDC reported that they were seeing higher rates of suicide among young people since the pandemic started. So I think that is definitely important, you know, just having that listening ear, feeling that you're heard as a young person especially.
We can't just stay there and say, my mother not understanding, the government not understanding. We have to be able to speak up for ourselves. And this right here is a good platform for us.
Yeah.
Somehow a vaccine dividing us.
Yeah.
I had the thing on my arm, and my mom is driving. She sees her friend on the side of the road, and he comes, and he's like, "Oh my God!"
Yeah.
He stepped back from the car. He's so afraid of it, and he's like, "You have to take this," and he's listing out this very scary concoction of medication that I need to take to repel that from my butt. People so open about being for and against the vaccine.
It's voluntary, so like you have your own personal choice, right? You want to take it, that's fine. You don't want to take it, that's okay, right? You have taken it, fine. You're not going to take it, all right. But why must you be so loud about it?
To me, all that is uncalled for, because at the end of the day, it's your personal choice and what you choose to do with your body. You know, but it really poses a serious problem, which is discrimination and segregation in a way.
I think what we really need is community. We need a sense of community. We need outlets to talk. We need that opportunity to communicate among each other. We need also for empathy. Students need to understand how their teachers feel. Parents need to know how their children feel. Everybody needs to understand that this is hard on all of us. So we need to communicate with each other. We need families to work together. We need little siblings to stop banging on the doors when we study them. We need communication. We need also the respect. We need respect for minorities. We need persons who in smaller groups, because sometimes when considerations are made, they are made to average person. But there are people who live in small families, people who can't afford to buy uniforms. There are people who can't buy a router. So these people need to be considered. We need to respect those people. So we need to just be kind. We need to be kind and understanding, because it's hard for everybody.
My youth, I heard your concerns. You brought it real and I appreciated that. Honestly, for you, I want to say that you represent being brave. Your bravery through this pandemic, the thoughts that you'll expressed, the challenges that you faced cannot go unnoticed. And for that, I want to acknowledge your bravery in soldiering through the past 2 years of challenges without giving up. And for that, I want to start off by saying you've been brave. And the being brave, I want you to pull out your paper and pen as well. I want you to just, pull out your phone, write something, make a commitment to yourself, a love letter to yourself, as it were. Because when it comes to self-care, we have to make a commitment. Brave. I want you to start off with B, your brain and your body. Never forget that there's a significant connection between the exercise and the activity that you do and the way that your brain functions. For example, the more movement that you put into your body reduces levels of cortisol. Cortisol is a hormone that's produced when you're stressed. So if you are able to move and to keep active, you can alter the way that your brain functions even. So with that, I want you to write down 2 things that you will commit to do to keep physically active. Childhood obesity has increased during the pandemic, and many illnesses have increased during the pandemic. Please ensure that you are moving around to take care of your mental health. The R stands for rekindle. I heard you say that you lost a lot of positive relationships. You lost the people that you were close to being locked away or put away. I want you to rekindle those, to make an effort. Write down the names of 4 persons, 2 adults and 2 young persons that you want to build strong positive relationships with. People who have your back through thick and thin. People that you can go to when you feel alone. I remember you mentioning in the video that you felt isolated. You felt as though you had to go through this on your own and you were locked away. Find those people and build strong positive relationships so that if you ever need someone to turn to, you can go to them. The A in brave says, ask for help. So many times, young persons go through challenges alone. We feel isolation. That's the reality of that stage in life. But please, ask for help. Reach out to someone that you trust. It can be a counselor, it could be a psychologist, a mental health professional that's there for your needs. If you feel as though you cannot find someone to talk to and you really need someone to talk to confidentially, you can go to this website, www.childlinett.org. There, you will find 3 options to help you speak to someone. 1, you can chat on a live chat box anonymously, and someone will be there to help talk to you. 2, you can download the app by searching for My Childline in the App Store. And there you can also chat with someone. And finally, you can dial 131 on Childline, and you can speak to someone about the challenges that you're going through so that you know that you are not alone. The V stands for Verify. You know when you go on your favorite celebrities page, you see that blue circle with a tick for Rihanna and all of that, you know? Verify. I want you to sit down and write this down. Verify, what are the top 4 concerns you have right now in your life? Sometimes it helps to verify what they are. I want you to take that list to one of the persons that you identified earlier and find ways to get help. It can be through the Childline resource, or it can be through an adult that you've reached out to. And write down those solutions so that you will be able to find a pathway forward through the challenges that you expressed. And the E stands for Express Yourself. You know that you have been gifted with natural gifts to ensure that you are resolute and able to fight through any challenge. Your body is made up of white cells. These white blood cells are designed to ensure that they fight diseases within you. The same applies to the gifts that are within you. Return to the things that you enjoy. They naturally help to reduce your stress. So my brothers, if you enjoy playing football and you burn a sweat now, and that made you feel better, return to that because now sports are reopened. And to my sisters, if you enjoy painting and drawing in your quiet time or even reading, return to that and do it outdoors on the beach, you know? Return to the things that made you feel joy, things that allowed you to forget the stresses that were in front of you that we could not do before. Express these things. I want you to write down 3 things that you will do that you feel helps you with your mental health. I want to end by saying to you, congratulations on being so brave. You have soldiered through so many challenges during COVID-19. You are the most resilient generation in the history of the world. And for that, I want to congratulate you. I heard your cries and I heard your pleas, and I beg of you, take note of these things, write down your action plan, and you can make a difference within your life.
It's the Honorable Faris Al-Wari, Attorney General of Trinidad and Tobago. Welcome to Pop. You're considered a heartthrob. They call her behind you, you try to teach her wine. What are you doing?
Wine back.
Somebody's getting a haircut.
So, sweetheart, from now, First of all, I don't trust my mother to cut my hair.
Where's my stool?
Folks, don't come on this program in a hurry.
We're not accepting that, Mr. AG.
It's hard to sing a song on national TV.
Sorry, don't even. Listen.
Exalted our God, and worship His holy name. For His mercy, exalt Him, His God, exalt Him, before exalt Him, exalt every nation, exalt Him, all creation, great and small, exalt the Lord.
अरे हाँ, आज तो हमारे लाडले बेटे का जन्मदिन है, तो आज तो हमको उसके सारे कारनामे भूल जाने चाहिए, उसकी सारी गलतियों को माफ कर देना चाहिए।
जब हम उसके डैड के कारनामों को भूल सकते हैं तो उसके क्यों नहीं?
What do you mean?
I mean कि बच्चे तो माँ बाप से ही सीखते हैं ना। जब आप इस वक्त घर वापस आ सकते हैं तो हम आदि से क्यों उम्मीद करें?
Stop overreacting.
Overreacting? हर्ष, कभी-कभी मुझे ऐसा लगता है कि आपको आजकल आदि की फिक्र ही नहीं है।
If you cut me, you go see blood, and if you squeeze me, you go feel the love. We are one people under the sun, one nation under the law.
What you have here today is a few members of the entertainment industry representing different sectors within the entertainment industry. And it's basically a conversation about how we have been affected by COVID, and thus our personal views and perspective on how the entertainment industry has been affected.
Yeah, this thing with this pandemic, what people didn't realize, arts and entertainment was hit the hardest. If you make $10 Friday, that $10 had to last you to whenever money come in. Because as Gleason could tell you, the behind story, behind production, you had to run the venue. Police, fire, EMA, health, public liability insurance, stage, song, lights, your workers to pay, security. The bills continuously go.
People don't see that. When you go through social media and you're seeing people making these comments about these promoters only out to make people money. At the end of the day, this is us putting on a product that people want.
The charges behind a production in Trinidad today, when you weigh it out, half the time a promoter doing break even, a DJ. They just feel like DJ coming out, open a laptop and put on headphones and playing.
Well, I can say COVID affected me at the go initially, because usually myself and a couple of Calypsonians, former Calypso monarchs like myself, Karina Ashe, Devon Seal, we would usually head to a couple universities across the United States. We usually do some lectures, performances, and that kind of thing. And, you know, just when we were about to leave the country, the check was about to go into the bank account. We got a call that the Prime Minister is closing down the country, and that's it. It stops there. You know, and that was that was the first major dent for me, financially, and also as an artist. It was a big lash.
I used to live out of a suitcase. I used to be out every weekend, making the money, making the dollar. You know, through the COVID, I get an opportunity to file my fingernails some more, sit down with my girls, my daughters, know who is the big one, boyfriend. Sit down with my son. I kind of watch COVID as a blessing with pros and cons.
And what is important for us to learn from Miami Carnival, I saw how strict they were. They were adamant that you cannot pass this gate unless you have the PCR test. I think if we can get sponsors on board to do it, or the government on board to subsidize that cost here, because anywhere you go in America, you can get your PCR test for free.
In a gas station. But gentlemen, I think we're missing something on how Trinidadians are cultured.
I hear you when you say the culture, blacks. But you know, we do things